Is December 1st, and that's World AIDS Day. It's a day for people around the world to get together in the fight against HIV.
So here to provide some information on the state of HIV in our area is Dr. Ofole Mgbako. He's an HIV specialist and a chief of infectious diseases at New York City Health and Hospitals Bellvue. So good morning, doctor. Thank you for being here on this important day.
Good morning. Good to be with you.
So doctor, how would you really summarize the state of HIV and AIDS, specifically here in New York City?
Yeah, it's a great question. So I think, we've come really far. We've made so many strides over the last 40 years, particularly in New York City, driving the number of new diagnoses down to historic lows. But really, it's a story of inequity these days, right? Because we see that the burden is really concentrated in certain communities. And so this past year, about 74% of all new diagnoses were in Black or Hispanic individuals. And we know that HIV often travels with other epidemics, substance use epidemics, and folks with mental health issues and homelessness. So really, there's a lot of work to be done. So it's a day that we kind of honor all the folks that we've lost, the beautiful souls we've lost, really kind of think about all the advancements that we've made to this point. And then think about the future and all the work that needs to be done.
Yeah, let's talk about the advancements then. Where are we as far as medicine is concerned when it comes to a vaccine possibly for AIDS?
Yeah, so, we've made a lot of strides where, I think a vaccine for HIV, we're still a bit far from that. But in terms of mRNA technology that we've seen with COVID and just scientific advancements over the years, the work is still being done to get to a vaccine, but our treatments are really, really effective. So now we have, a pill a day that you can take. So we've really simplified that regimen, and not really any side effects to speak of in a lot of people. And now that there are long-acting injectable medications on the market, that's another kind of tool that we have for folks who struggle taking a pill a day.
Yeah.
So we've really made a lot of strides.
Yeah, I mean, obviously there's a whole lot of progress on the research front, on the medicine front too, but there's still progress to be made, I guess, on the stigma front, right? The former Speaker of the City Council, Corey Johnson, he was very open about his HIV diagnosis, and a lot more people have been coming out and say, look, we're positive, we're undetectable, but there's still this stigma around it. Can you talk about that?
Yeah, thank you so much for that question, because it's such a huge focus for me, particularly with my patients. And I think it's important for people to know that folks die of stigma, right? I think, and that's completely man-made. That's completely coming from lack of understanding from, our society. Really, the stigma around HIV was originated, when we saw the first diagnoses in the 80s. And some people still feel the brunt of that. Some people still feel a diagnosis means that their life is over, that they can't dream, that they can't continue to live a normal life. And so much of the work I do is kind of reassuring my patients around that. So really, I think there's so much more that needs to be done in terms of community education and engagement around this, because, the science has really gotten us to a place where someone can live a normal, healthy life.
Yeah.
So I think everyone else has to do their part.
Yeah, that's true. That's for sure. Well, and because of that stigma, though, because of that fear, I'm sure a lot of people don't want to come forward and get tested, right? So where can folks go to get tested?
Yeah, so there's a lot of different ways folks can get tested these days. Certainly in our clinic or any of the public health hospitals, there are the sexual health clinics throughout the city in almost every borough. There's also at-home tests that people can take. Some people don't like kind of going into a doctor's office. There are mobile clinics. So there are a lot of different options these days. And there's always a group of people out there who don't know their status. So this is an important day to just remind everybody to get tested, because I think knowing your status really just means that we can move forward with treatment and living a normal, healthy life.
Yeah, and it's certainly a lot of progress has been made, but there's still a long way to go. Thank you for being here, Dr. Mgbako, to talk about this, break some of that stigma on this important World AIDS Day. Appreciate you being here.